Hello, this is Nick Wohler. I'm talking about osteoporosis today. That's my disease that I chose. To jump right in, osteoporosis is when bones become less dense and they're more susceptible to breaking and fractures. This is seen a lot in older age as well as women. We can get into that a little bit later when we talk about risk factors. But to start, I want to talk about symptoms a little bit. Symptoms are hard to come by with osteoporosis because a lot of times it's too late when you figure out that you have osteoporosis. So a lot of times there will be a break or a fracture that you have that you know about, but you didn't know you had osteoporosis, and that is what makes you figure it out. But also a lot of times, sometimes there is pain, and as well as you can see that you're getting shorter, visibly see that you're getting shorter, so you can go into a doctor if you have pain, or see that you're getting shorter and see what the cause of this is, and they could diagnose you with osteoporosis at that time. But like I said, a lot of times it's when you already have a fracture, and that's when you kind of figure out that you have osteoporosis. Some biological causes. Bone is a tissue, meaning it gets replenished and it gets replaced throughout the body's life. And so there's what's called an osteoblast and an osteoclast. And what an osteoclast is it's what breaks down and dissolves the bone tissue. And what osteoblast is it builds up the tissue. So as we get older, we are producing more osteoclasts than osteoblasts, meaning that not enough bone tissue is being made, and it makes it more fracture, or makes it easier to fracture than what a normal bone would be. A lot of things that lead, or a big deal to this would be the hormones in the body, estrogen especially. This is why women a lot of times are more susceptible to osteoporosis than men are. Testosterone has something to do with it as well, but it's not as prevalent as estrogen is. So those are kind of the biological causes of osteoporosis. Some risk factors that we got are age, sex, and family history. So age, if you get older, as you get older, your bones will start to weaken. This just has to do with your hormone levels, not as high, obviously, after menopause for women, and they're just not as high in males as well. Sex, women, obviously, after menopause, they don't have the hormone levels, so this puts them more at risk because they don't have the estrogen that they need to produce healthy bones, so it can leave gaps there in the bone tissue. And then family history, a lot of times if your mom or dad has osteoporosis, you're more likely to get it, just like anything else that would be hereditary. Diagnosing osteoporosis, there is a machine that they use to diagnose it. It's an x-ray machine. Essentially, it's just at a lower frequency, and they can tell the bone matrix. They can see the makeup of the bones and see if there's gaps in the bones. At your doctor's office, I'm sure most doctors possess this tool. Treatment, there's osteoporosis medication that a lot of people use. This is kind of like the first line of defense per se. There is also another therapy that is used. It's called hormone-related therapy. This is to raise the hormone levels in hopes that it would kind of replenish the bones as they normally would be prior to older age. So it's more older people that want to raise the hormone levels so that their bones can become normal again. To prevent osteoporosis from happening, you want to stay healthy. You want good nutrients in the body. You want to keep your calcium and vitamin D levels at a sufficient rate, because with calcium in the body, it makes the bone stronger. It makes the build up the matrix stronger. So that would help. Some don'ts for not wanting osteoporosis. Obviously, don't heavily drink. Heavily drinking is bad. It can lead to osteoporosis. It's just not good for the body overall. As well as smoking. I feel like smoking is pretty self-explanatory. Smoking is not good for the body as well. So it can also lead to it could put you at a higher risk for osteoporosis. So last thing I want to do here is show you a picture of, we have on the right we have a non-osteoporosis bone matrix, if I can get out of here. And then on the left we have osteoporosis looking bones. You can see that there's more space in the bone matrix with osteoporosis on this side, and then there's less gaps and less spaces on this side. So this is kind of what the bone matrix would look like in osteoporosis, and this is kind of a normal bone. So obviously you would want this one as opposed to this one, so your bones don't fracture and you don't have injuries. Thanks for watching.